Hello guys, I'm back with another video, and today's video is going to be an advice video on how to go about doing an NHS interview for a mental health occupational therapy role. If you haven't watched my first video on interview questions, advice and tips on physical health occupational therapy within the acute setting, then go watch that video. This is a video I've kind of stalled on because mental health is, like physical health, quite broad, but with mental health it's very dependent on the setting that you're working in as well. So with mental health occupational therapy, you have the community setting, meaning a building in which you work at and clients come to you within clinic rooms, or you are going to clients' homes. And then you have the acute mental health setting, which is basically where you have people that are admitted as inpatient, so they're basically people that stay on the ward. So these are the two types of setting you can work in, but it goes a step further with mental health within the acute, or rather within the inpatient settings, not acute. Within the inpatient setting, it goes a step further where you can also have forensics. So these are dealing with people that have also committed or have been involved with the criminal justice system. So say for example someone has bipolar, and because of this it's caused them to act out on the streets and cause public offence. Then they end up going and being detained, and then they end up going into like a forensic mental health inpatient unit because of this. So this is just an example of many. So what to expect when you have a mental health occupational therapy interview. I think the best way to do this, which might apply to many settings, is to do this with maybe an acute setting in mind. With a mental health occupational therapy interview, from the ones that I've done, you typically get about 6 questions or 7 questions, and you normally have at least 2 interviewers. The advice I would say for a mental health occupational therapy interview is to make sure that you look at the person specification. As I mentioned in a previous video, it literally spoon feeds you and gives you the details that you need to know in terms of being able to prepare for an interview and being able to prepare for submitting an application. One thing I would definitely advise is to really hone in on the application side of things and mention the stuff that is relevant to your experience. Where you see A, that's where they're basically saying that in the application form that you submit, that's how they're going to test your knowledge. So where you see significant clinical experience, including individual and group work, it says it's desirable, and it says that it's going to assess your knowledge on that through the application, but also the interview, which is the I. And then you also see that it mentions working with mental health service users, and it says that that's essential. So it's basically saying, I need you to have worked with mental health users before, and it will be looking at testing you via the application and the interview. So in the interview you may get a question like, oh, like tell me about your experience of working within a mental health setting. What experience do you have? That kind of prepares you for the types of things that they're going to ask you, and that prepares you for the things that you should include in your application, in your statement. I would say the common things that I've come across with mental health, knowing about legislation. So legislation can include the Mental Health Act. Normally if there's one thing you need to study is the Mental Health Act. Like, what is that act? Like, what does it do? What powers does it grant? And what is your role in that as an occupational therapist? And also one of the things that is looked into is the community treatment order as well. You need to know about that. If you're working in social services, you need to know about legislation regarding social work. So it could be things like the Care Act. You need to know that. In terms of the inpatient setting, you need to know about the Mental Health Act. You need to know about community treatment order. You need to know about the Community Care Act. These are the things that you need to go ahead and research. You don't need to dive like deep into it, but you just need to know what these are, have an awareness of them, and know that how it kind of applies to your work. Guys, I really don't want my battery to be low. I'm actually gonna scream if it is. Anyway, another thing you need to know as an occupational therapist is about the interventions that you can do within a mental health setting. So this can be inpatient, this can be community, whatever role you're applying for. Typically the types of intervention you do, they can vary a little bit. I would say with the inpatient mental health settings, you do a lot more group work. With the community settings, you're obviously going to do likely more one-to-one work. So you need to think about, okay, if I'm applying for an inpatient role, and in inpatient setting, you've got a group of people on the ward, a lot of them likely have similar difficulties. What can I do with this group of people? So An example is maybe you have a group of people on the ward that have weight gain because they're taking medication that causes them to increase in weight, or they're not motivated to look into healthy eating. So you would then think of a group on the wards that you can do, such as a healthy eating group, an exercise group. If you want people to be able to integrate into the community, for example, when these people are discharged from the hospital, that is the hope. You want these people to be discharged. You know, you don't want them to become desensitized. You want them to be able to still maintain the skills of being able to live out in the community. These are the types of things that you need to think about, like how are the groups of people I work with impacted on, and what can I do as an occupational therapist in the community? You know, a lot of things that people struggle with is motivation. So people have difficulty in being able to feel motivated to do things. For example, people that have depression, people that have all these range of mental health conditions such as bipolar, EUPD, OCD. These things can impact on people's motivation levels for many, many reasons. And you have to think of, okay, if this person's struggling with motivation to engage in activities, what are the things I can do with this person? So you would be doing goal setting, you would be doing SMART goals, you would be breaking down activities, you'd be working with this person one-to-one to work out the things that they enjoy, work out what they find meaningful. I'm basically giving you a lot of the answers, but these are the types of things you look out for. Like, how can I as an occupational therapist help this client group in the community? And the thing that you can do to prepare for this, if you haven't had a lot of experience in mental health, is to look at videos, like research videos of a day in the life of an occupational therapist in mental health, research videos of videos where you have occupational therapists talking about what they do in mental health settings. And if you have not seen those videos already on my channel, they are linked. I'll put them in either in the description or above. Yeah guys, you may have had experience on the ward, you may not have. It's important to be honest in your application, but it's important to not come across as completely clueless. Like, at the end of the day, even if you don't have any experience in mental health, the interviewer is going to ask you what types of interventions you would do, what types of things you would think of. This is going to happen. There's no way it's not going to be asked. It'll be very, very hard for it not to be asked. So I would say that's one of the key things. Like, the key thing here is the interventions you would do as an occupational therapist, the legislation around the setting that you're working in, and just typical interview questions. Tell us about yourself, all those stuff that you can Google, you can research on YouTube. Like, these are all the things that you can do. Very, very varied, as I mentioned, depending on the setting, but these are the key things that I found and the patterns that I found in mental health interview. Again, I always say that what's for you, I believe will be for you. Sometimes it's about personality, sometimes it can be a personality hire, sometimes it's that they don't think you're gonna fit in with the team. You could have all the answers, but they just don't feel like you're gonna fit in with the team. So do the best that you can, I would say. And your key doc is going to be the person specification, and making sure that you note the things you need to in the application to even get invited for an interview, and making sure that during the interview you're answering these questions. I think one of the best things you can do is just be prepared for an interview. Like, don't go there being completely clueless, unsure about the types of questions they could potentially ask you. You've got the person specification for a reason. So yeah guys, that's my occupational therapy mental health interview advice and tips, how you can, you know, do well in an interview. This is how I've been able to secure jobs. There's not been one mental health job that I haven't secured. And yeah, I've worked in various mental health settings, so hopefully you find this helpful. And yeah guys, I will see you again for another video. Take care.